That constant ringing in your ears is not normal. It is not a byproduct of stress. It is not an inevitable consequence of getting older. And it is absolutely not something you are obligated to simply accept and endure for the rest of your life. That might be a difficult statement to encounter after months or even years of being told the opposite by medical professionals. But it reflects what a growing body of clinical research and nutritional science has made increasingly clear. What most doctors fail to communicate during a brief 10-minute consultation, because they are operating within a system designed to manage symptoms rather than investigate their underlying origins, is something critically important. In approximately 70% of tinnitus cases, that persistent, maddening buzzing, that ringing that simply refuses to stop, that noise you can hear even in the most absolute silence of the night when the rest of the world has gone completely quiet, is a direct physiological signal. It is your body communicating loudly and insistently that it is missing specific nutrients it urgently needs in order to maintain the health and proper function of your auditory system. Think for a moment about what living with this condition actually feels like on a daily basis. You go to bed at night hoping that sleep will offer some relief, only to find that instead of being greeted by silence, you hear a continuous, unrelenting tone, like a television left on in another room that no one ever seems to turn off. You wake up in the morning and it is still there, exactly where you left it. You go to work and it hums in the background of every conversation, every phone call, and every quiet moment you try to carve out for yourself. You sit across from a friend or a family member and try to focus on what they are saying, and that buzzing competes for your attention with every single word they speak. And then comes the most demoralizing part of the entire experience. You go to see a doctor, perhaps multiple doctors, and they run their tests and look at their results and tell you with a kind but firm certainty that there is nothing to be done, that you have tinnitus, that you simply have to learn to live with it. But here is something that no one may have properly explained to you yet, that ringing has a very specific physiological origin, and it is directly connected to nutritional deficiencies, identifiable shortfalls in the minerals, vitamins, and protective compounds that the cells of the auditory nerve and the tiny, delicate blood vessels that feed the inner ear depend upon to survive and function correctly. When those deficiencies are properly identified and corrected through the right combination of foods and, where necessary, targeted supplementation under medical supervision, tinnitus can be significantly reduced in its intensity. In many cases, with consistency and sufficient time, it can diminish to the point of disappearing completely. More than 750 million people around the world currently live with chronic tinnitus, and the vast majority of them have never received a nutritional explanation for their condition. They have been prescribed medications designed to manage dizziness or anxiety. They have been referred to sound therapy and cognitive behavioral therapy. They have been encouraged to download white noise applications and told that psychological habituation is their only realistic long-term goal. Conventional medicine, for all of its enormous strengths, is built and structured to treat symptoms. What so many tinnitus sufferers genuinely need, however, is for someone to investigate the root of the problem. And what clinical observation and nutritional research increasingly demonstrate is that the root is very often nutritional in nature. To understand why nutrition matters so profoundly in this context, it helps to understand what is actually happening inside the ear when tinnitus occurs. Deep within the inner ear are structures called hair cells, extraordinarily specialized cells whose sole purpose is to detect the mechanical vibrations produced by sound waves and convert them into electrical signals that can be transmitted along the auditory nerve and ultimately interpreted by the brain as recognizable sound. These cells are among the most metabolically demanding in the entire human body, requiring a constant and reliable supply of oxygen and specific micronutrients just to perform their basic moment-to-moment functions. And yet they possess virtually no capacity for self-renewal or regeneration. Once damaged beyond a certain threshold, they cannot repair themselves. This makes them uniquely and acutely vulnerable to any condition that consistently deprives them of what they need. When hair cells are operating under conditions of chronic nutritional deficiency, even if they have not been completely destroyed, even if they are functioning at some diminished level, they begin to malfunction in a very particular and consequential way. They send erroneous electrical signals up the auditory nerve, signals that do not correspond to any actual sound occurring in the external environment. There is no tone being produced, no voice being spoken, and yet the hair cells are firing, generating impulses that travel to the brain just as they would if a real sound were present. The brain receives these signals and does exactly what it is designed to do. It interprets them as sound. That perceived noise with no external source is what we experience as tinnitus. Compounding this problem further, the small blood vessels that supply the inner ear, the labyrinthine artery and its branches, are among the finest and most delicate blood vessels in the entire body. When certain key nutrients are deficient, these vessels tend to constrict. Blood flow to the inner ear decreases, and the hair cells receive even less oxygen and nourishment than they already desperately need. The result is more erroneous signals, more buzzing, and greater perceived intensity. To illustrate how powerfully nutritional intervention can disrupt this cycle, consider the case of a 62-year-old engineer who arrived at a specialist clinic 7 months prior in a state of profound emotional and physical exhaustion. He was a man whose entire professional life had been built on solving complex problems with logic and precision, but this particular problem had completely defeated him. He had been hearing buzzing in both ears for 3 years. It had begun subtly, a low hum at night he initially attributed to the stress of a demanding career. But it had progressed relentlessly until it was a constant, unrelenting presence in every waking hour. By the time he sought specialist help, he said he could no longer remember what silence felt like. The sound had become so entirely woven into his experience that the memory of living without it had simply faded. He had pursued the conventional medical system with considerable diligence and determination. He had consulted 2 separate otolaryngologists, a neurologist and an audiologist. He had undergone comprehensive audiometry testing, an MRI to rule out any structural abnormality, and multiple rounds of blood work. In every case, the results had come back within what the reviewing physicians classified as normal parameters. He was prescribed medication commonly used to manage inner ear dizziness and referred to a cognitive behavioral therapist with the goal of developing psychological strategies to reduce the distress associated with the noise, to train his brain, in essence, to notice it less. But it had not worked. The tinnitus was too loud, too constant, and too intrusive to be quieted through willpower and breathing techniques alone. The condition had begun systematically dismantling his daily life. His ability to concentrate at work was severely compromised, making the analytical thinking that had once defined his career exhausting and unreliable. He had withdrawn from social situations, particularly those involving multiple people speaking at once, because the layering of voices over the constant background buzz was genuinely unbearable. His sleep had deteriorated to between 4 and 5 hours per night, because the nighttime quiet that most people find restorative had the paradoxical effect of making his tinnitus seem louder and more oppressive than it did during the day. His marriage was under strain from the chronic irritability and exhaustion that had accumulated over 3 years of inadequate rest and relentless noise. The detail that was most difficult to hear was when he described his 8-year-old daughter asking him, with the guileless directness of a young child, why her father no longer played with her. He said he had not known what to tell her. When his blood work was reviewed through the specific lens relevant to patients presenting with chronic tinnitus, examining not merely whether values fall within broad population reference ranges, but whether they are genuinely optimal for neurological and auditory function, the picture became significantly clearer. His zinc levels sat at the very lowest boundary of the acceptable range. His vitamin B12 was within the limits that most laboratory reports would classify as normal, but at a suboptimal level that clinical research has associated with progressive deterioration of the myelin sheaths that insulate and protect nerve fibers, including those of the auditory nerve. His magnesium measured correctly within red blood cells rather than in serum, a distinction that matters greatly since serum magnesium can appear normal even when cellular magnesium is genuinely depleted, was clearly and significantly deficient, and his vitamin D3 was below 20 nanograms per milliliter, the widely recognized minimum threshold below which neurological function becomes meaningfully compromised. The physician who had reviewed these results previously had marked them all as normal, and by the broad, population-level standards of conventional laboratory medicine, they technically were. But normal and optimal are not the same thing, and that distinction matters enormously when it comes to auditory health. The auditory nerve does not need levels that are merely adequate for the average adult. It needs levels that are genuinely sufficient to supply the hair cells, nerve fibers, and blood vessels of the inner ear with what they require to perform at full capacity. Falling even modestly short of that standard can make a decisive and lasting difference in a person already living with tinnitus. A comprehensive nutritional protocol was designed around these findings, covering which foods to prioritize, what to supplement under medical supervision, and which habits to modify in order to actively protect and nourish the auditory system. 6 weeks later, the patient returned and, before he had even taken his seat, said that he had experienced 3 nights of almost complete silence that week. 3 nights in 3 years. By the 4th month, the ringing that had previously been the unbroken background noise of his entire existence had become intermittent rather than constant. He was sleeping properly, working with a focus and productivity he had feared were permanently lost, and had recently spent 2 hours at the park playing with his daughter. The 8 nutrients at the heart of this improvement each address a specific aspect of auditory vulnerability. Zinc is the most critical mineral for inner ear health, and the one most consistently found to be deficient in tinnitus patients. The hair cells of the inner ear contain one of the highest natural concentrations of zinc in the body, depending on it for protection against oxidative stress, for essential enzymatic functions, and for maintaining the structural integrity of cell membranes. When zinc is scarce, these cells become far more vulnerable to damage and begin misfiring more frequently. Oysters are the richest source on Earth, followed by lean beef, pumpkin seeds, unsalted cashews, and dark chocolate, above 85% cacao. Eating pumpkin seeds daily and incorporating lean red meat twice a week are simple and sustainable ways to begin restoring zinc levels consistently. Magnesium protects inner ear cells against noise damage and oxidative stress, while keeping the small blood vessels of the labyrinth relaxed and open. When magnesium is deficient, these vessels constrict, blood flow decreases, and hair cells receive progressively less oxygen. Clinical studies have demonstrated that correcting this deficiency reduces the severity of noise-induced hearing damage and lessens the perceived intensity of tinnitus. Almonds, cooked spinach, avocado, pure cacao, sunflower seeds, and brown rice are all excellent dietary sources. A dinner that pairs steamed spinach with a handful of almonds and half an avocado can supply more than half the daily requirement through food alone. Vitamin B12 is essential for maintaining the myelin sheaths that protect the auditory nerve and allow signals to travel accurately from the ear to the brain. When B12 falls below optimal levels, myelin deteriorates progressively, signals become distorted, and tinnitus results. Research has found that 68% of chronic tinnitus patients have deficient or suboptimal B12 levels, and that correcting the deficiency produced significant tinnitus reduction in 47% of them within 6 weeks. B12 is found almost exclusively in animal-based foods. Beef liver, sardines, salmon, eggs, and cottage cheese are among the richest sources, and its absorption decreases substantially with age. Anyone over 50 or following a plant-based diet should discuss supervised supplementation with their physician. Vitamin D3 functions as a neurohormone that actively regulates hundreds of genes in the nervous system, including those governing the protection and maintenance of the auditory nerve. Multiple studies have found a statistically significant correlation between low vitamin D3 levels and greater prevalence and intensity of tinnitus. Dietary sources include wild salmon, tuna, egg yolks, and full-fat dairy products. But diet alone rarely maintains optimal levels. 15 to 20 minutes of direct sun exposure daily, ideally between 10 in the morning and noon, with arms and legs uncovered, is a free and highly effective way to maintain adequate vitamin D3 synthesis. Omega-3 fatty acids, particularly EPA and DHA from oily fish, protect the auditory system by countering the chronic, low-grade systemic inflammation that impairs inner ear circulation and amplifies hearing damage, and by improving the fluidity of auditory nerve cell membranes. Salmon, sardines, mackerel, herring, and anchovies are the richest bioavailable sources. Eating oily fish at least 3 times per week provides a consistent and meaningful supply, while ground flax seeds and walnuts offer a less efficient, plant-based alternative. Ginkgo biloba acts directly on the vascular mechanisms underlying tinnitus. Its active compounds improve microcirculation within the inner ear, dilate the fine vessels supplying the labyrinth, and exert documented antioxidant and neuroprotective effects. These circulatory benefits can be reinforced through regular dietary intake of fresh ginger, raw garlic, unsweetened green tea, and turmeric with black pepper, all of which carry natural vasodilating properties that actively support blood flow to the inner ear when incorporated consistently into daily meals. The B vitamin complex, specifically thiamine, niacin, and pyridoxine, supports auditory health through distinct and complementary pathways. Thiamine supports reliable nerve impulse conduction. Niacin improves inner ear circulation and is particularly relevant in tinnitus associated with Meniere's disease. Pyridoxine governs the synthesis of neurotransmitters that regulate how the brain processes and interprets auditory signals. Whole grains, tuna, chicken, bananas, chickpeas, boiled potatoes with skin, and eggs are all reliable sources of this vitamin group. A breakfast of whole grain oats with seeds and an egg delivers a meaningful combined dose of all 3 before the day has properly begun. Finally, antioxidants, in particular N-acetylcysteine and vitamin C, address the oxidative stress that continuously attacks hair cells, especially in people exposed to loud noise, tobacco, or chronic inflammation. N-acetylcysteine stimulates the internal production of the glutathione, the most powerful antioxidant the body manufactures from within, and its natural synthesis can be encouraged through regular consumption of sulfur-rich foods such as garlic, onions, asparagus, and broccoli. Vitamin C, found abundantly in raw red bell peppers, strawberries, kiwis, and citrus fruits, works in direct biochemical partnership with glutathione, helping to regenerate and extend its protective action across the tissues of the auditory nerve. A practical and immediate way to begin incorporating all 8 of these nutrients is through a single, well-designed meal. A dinner of baked salmon with steamed spinach alongside a salad of pumpkin seeds and avocado dressed with olive oil and fresh lemon delivers meaningful amounts of zinc, magnesium, omega-3 fatty acids, vitamin D3, and antioxidants all at once. Preparing this meal 3 times during the coming week and paying careful attention to any shifts in tinnitus. Intensity is a meaningful and entirely accessible first step. Nutritional correction does not produce immediate results. Deficiencies that have accumulated over months or years require sustained effort to reverse. But the first noticeable changes typically begin to emerge within 2 to 3 weeks, with more substantial improvement developing over the following months of consistent dietary practice. The case described here is not an exception. It represents what becomes possible when tinnitus is approached not as an immutable neurological verdict, but as a condition with identifiable, addressable physiological causes. 3 years of constant, debilitating noise that had progressively eroded sleep, professional performance, relationships, and quality of life, gave way to intermittent and manageable ringing within 4 months, through the targeted correction of specific nutritional deficiencies that had gone unrecognized in every prior evaluation. Your inner ear works without rest every second of every day of your life, performing the extraordinary task of translating the physical vibrations of the world around you into the electrical language of the brain. It deserves to be nourished with the same care and intention that it brings to its own endless work. The nutrients that support it are not exotic or prohibitively expensive. They are found in real food, in sensible daily habits, and in a willingness to look at the body not as a collection of symptoms to be suppressed, but as a living system with specific, identifiable needs that when met consistently and patiently, has a remarkable capacity to begin healing itself.